Welcome, and thank you for joining us today for the Meet an Ultomiris STAR webinar. My name is LeeJean, and I am a Patient Education Manager at Alexion. In my day-to-day, I get the pleasure of working with people impacted by NMOSD. I'd like to thank the Patient Health Alliance for partnering with us to bring this webinar to you all. We are excited for today's discussion, which will hopefully give you an understanding of what Ultomiris is and some of the experiences NMOSD patients have had while on this therapy. I'll start with a 15-minute overview of Ultomiris for anti-aquaporin 4 or AQP4 antibody-positive NMOSD, and then we will go into a panel discussion with three of our STAR ambassadors, Denise, Ilona, and Virginia. Our STAR ambassadors have been compensated by Alexion to be here today. And before we get started, a reminder that the information in this presentation is intended to be educational for people living with NMOSD and their caregivers. It does not replace your doctor's independent medical judgment or clinical diagnosis. It is important that you speak with your doctor about your NMOSD and any specific symptoms you may be experiencing. The important safety information for Ultomiris, including the boxed warning regarding serious meningococcal infections, will be shared throughout the presentation. The package insert and the medication guide can also be viewed at the URL appearing at the bottom of your screen at any time. With that, let's get started. Ultomiris is a prescription medication and is an FDA-approved complement inhibitor for adults with NMOSD who are anti-aquaporin 4 antibody positive. So it's not known if it is safe or effective in the use of children. Now we'll take some time to review the important safety information associated with Ultomiris. Ultomiris is a medication that affects your immune system and may lower the ability of your immune system to fight infections. Ultomiris increases your chance of getting serious meningococcal infections that can become life-threatening or fatal if not treated early. It is important to know that before starting Ultomiris, you must complete or update the meningococcal vaccination series at least 2 weeks prior to your first dose of Ultomiris. If you have not completed your meningococcal vaccinations and Ultomiris must be started right away, you should receive the required vaccines as soon as possible. If you have not been vaccinated and Ultomiris must be started right away, you should also receive antibiotics for as long as your healthcare provider tells you. If you have meningococcal vaccinations in the past, you might need additional vaccinations before starting Ultomiris. Your healthcare provider will decide if you need additional meningococcal vaccines. Meningococcal vaccines do not prevent all meningococcal infections, so call your healthcare provider or get emergency medical care right away if you recognize any of the signs and symptoms of meningococcal infection. And those will be reviewed in greater detail on the upcoming slides. The Champion NMOSD trial was the trial that was used to bring Ultomiris to real life in patients with NMOSD. So the efficacy and safety of Ultomiris were studied in the Champion NMOSD trial. And Ultomiris was studied in adults with anti-aquaporin 4 antibody-positive NMOSD. The Champion NMOSD trial consisted of 58 adults taking Ultomiris and 47 adults who were in a placebo group from a previous trial. And the rationale for doing that is because it was considered unethical to give a placebo treatment during this trial when there were FDA-approved NMOSD treatments available. The primary goal of the clinical trial was to measure the time it took for patients to have their next attack as determined by a panel of experts. So what was the risk of relapse? How many participants experienced a relapse? And what side effects did the study participants experience? The participants had experienced at least one relapse in the past 12 months before the trial started. So that was part of the criteria to enter the trial. And when the study began, about half of the patients that were taking Ultomiris were also taking additional immunosuppressive therapies, and they were permitted to continue those throughout the study. The participants in the study were observed for a median of about 73.5 weeks. So what were the outcomes? What happened in the trial? 100% of participants in the Champion NMOSD trial experienced 0 relapses with Ultomiris treatment. The primary goal was achieved. Ultomiris offered a 98.6 reduction in the risk of relapse compared with placebo. There were 0 relapses observed during the clinical trial for people taking Ultomiris. And the most common side effects that were reported in greater than or equal to 10% of the Ultomiris patients were COVID-19, headache, back pain, and urinary tract infection and joint pain during the trial. Serious adverse events were reported in 8 adults with NMOSD receiving Ultomiris, and the majority of those were infections. Ultomiris offers reliable maintenance dosing once every 8 weeks. Initially starting with a loading dose, patients will receive that, and then 2 weeks later will start the first of their maintenance phase. After that, their maintenance doses are every 8 weeks, and this offers 6 to 7 infusions per year. Ultomiris is an IV medication which is administered through a vein in your arm, and while travel times may vary, the infusion lasts just under an hour, and then after the infusion, you'll be required to be monitored by the practitioner after the infusion. If an adverse reaction happens, the care providers know typically how to deal with that, and what will happen is the infusion may be slowed or stopped, and they'll contact the prescriber. Before you start treatment, there are some things to consider. Because of the way Ultomiris works, it can lower your immune system's ability to fight serious infections, such as meningococcal infections. Ultomiris may also increase the risk of other types of serious infections, and it is important to recognize the signs and symptoms of meningitis and report them to your healthcare provider immediately. Meningococcal vaccinations do not prevent all meningococcal infections. So remember, it is important before starting Ultomiris, you must complete or update your meningococcal vaccinations at least 2 weeks prior to starting that first dose of Ultomiris. Again, if you have not completed your meningococcal vaccinations and Ultomiris must be started urgently, you should receive the required vaccines as soon as possible. And if you had meningococcal vaccines in the past, you might need additional vaccines before starting Ultomiris. Your healthcare provider will help you decide if you need additional vaccines. If you have not been vaccinated, again, an Ultomiris must be started right away. You should also receive antibiotics to take for as long as your healthcare provider tells you. So a little bit more about meningococcal infections. As I said before, we would go over some of the signs and symptoms of what a meningococcal infection looks like. So call your doctor or seek medical care immediately if any of these following signs and symptoms appear. It's fever with a headache, fever with high heart rate, headache and stiff neck, maybe sensitive to light, flu-like symptoms, confusion. Any of those symptoms you don't want to take lightly, and you want to make sure that you contact your provider as soon as possible. In addition, you will be given a patient safety card, and this patient safety card you want to carry with you at all times and at least 8 months after you finish your last Ultomiris dose. And the reason that you want to carry this card is to share that with any of your healthcare providers, nurses, doctors, anyone on your healthcare team, just so that they understand that you're on Ultomiris and what the signs and symptoms of meningitis are. So your healthcare provider may give you this patient safety card. If you're enrolled in one of our programs, we will have those sent out to you as well. There's a variety of ways that you can get a patient safety card. Additionally, our Ultomiris is only available through a strict REMS program, and that is a risk evaluation mitigation strategy program. And what that means is your provider who is prescribing Ultomiris, as well as anyone who is dispensing or infusing the Ultomiris, has to be educated on the risks associated with the meningococcal infections and be enrolled in the REMS program. It is important to know, too, that Ultomiris can increase the risk of other serious types of infections, such as strep pneumonia, Haemophilus influenza, or Neisseria gonorrhea. Who should not receive Ultomiris? Anyone who has a serious active meningococcal infection when you're starting Ultomiris should not receive Ultomiris. Additionally, before you receive Ultomiris, you want to tell your doctor about all of your medical conditions, including if you have an infection or a fever. If you are pregnant or plan to become pregnant, it is not known if Ultomiris will harm your unborn baby. There is also a pregnancy registry, and the URL is listed there on the screen. So if you become pregnant while taking Ultomiris, you want to, number one, contact your provider, and number two, make sure that you enroll in the Ultomiris pregnancy study. If you're breastfeeding or plan to breastfeed, it is not known if Ultomiris passes into the breast milk, so you should not breastfeed during your treatment and for at least 8 months after your final dose of Ultomiris. And additionally, as you do with any appointment, you want to make sure that you update your doctor or your healthcare provider on the medications that you're taking, any vaccines that you've taken, and any other vitamins, herbal supplements, etc. What are the possible side effects of Ultomiris? During the infusion, sometimes you could have a reaction, and you want to just make sure that you communicate that with the person that's providing your infusion. And if you have any trouble with that, they will slow it down, stop it, and they will reach out to your healthcare provider. The most common side effects for people with NMOSD during the clinical trial taking Ultomiris were COVID-19 infection, headache, back pain, UTI, and joint pain. So you also want to make sure, any other side effects that are bothersome to you while you're taking Ultomiris, you want to make sure that you reach out to your healthcare provider to let them know. And then also you may report those side effects to the FDA at 1-800-FDA-1088. So you may be asking yourself, is Ultomiris right for me? And Ultomiris may be right for you if you have anti-AQP4 antibody positive NMOSD and you're an adult who has been recently diagnosed with NMOSD, is continuing to have relapses or adverse side effects with your current therapy, and if you're interested in potentially reducing the risk of a future NMOSD relapse. Now that we've covered the overview of Ultomiris and important safety information, let's discuss further with our panel. I'd like to welcome Denise, Virginia, and Ilona. Together, we'll talk about how their symptoms began, how they reached a diagnosis, their experiences with Ultomiris as a treatment option, and practical tips for navigating life with NMOSD day to day. Our stars will be sharing their own experiences with Ultomiris and NMOSD, and your own individual experience may be different. To start, can each of you share a bit about your life before experiencing NMOSD symptoms and what changed when NMOSD began to affect you? Let's start with Ilona.
Hi, my name is Ilona, and I'm from Virginia. I grew up as an Army brat. That's where I got my love of travel and an urge for independence. I spent years at an international law firm, first as a legal secretary and later as an event coordinator, meeting guests and moving across our 10-story building. As painful, persistent muscle spasms escalated, It became difficult moving across our 10-story building, and it became hard for me to sit still and keep my balance. My legs would give out, and I started cutting back at work. ER visits brought temporary relief, but no answers. The unrelenting spasms and loss of independence finally pushed me to find a neurologist who could see me as soon as possible, which began a new chapter in my medical journey.
Thank you, Ilona. I know that the loss of independence due to symptoms with NMOSD can be very challenging. Denise, let's hear from you next.
Hi, my name is Denise, and I'm from Chicago. For 4 decades, I lived a big, vibrant life. I was constantly moving, working, or planning. I opened my first daycare center at the age of 21, and eventually I owned 5 of them. Outside of work, my husband and I filled our life with travel. We've seen the Great Pyramids, we've danced at the foot of the Eiffel Tower, and we visit historical places in Ghana, my home country. We lived a life full of freedom, fast pace, and fun. Then one spring morning, while walking our Labradoodles, Harley and Hunter, an odd tingling began in my right toe, creeping up my right side. By day's end, I went to bed hoping that it would pass, but by the morning, I was numb from my chest down and could not walk. My husband drove me to the ER where they examined me and then initially sent me home. But I knew something was wrong. So the next day, I went back to the hospital. This time, I had a voice. I asked more questions, I pushed for more tests, and I was admitted. And then began weeks of tests to understand what was happening to me.
Thank you, Denise. It's very good that you advocated for yourself there in the end. I think that's really important because it seems that that must have been a pretty important turning point for you in your journey as well. Virginia, let's hear from you.
Hi, my name is Virginia, and I'm originally from the Midwest and now reside in rural Colorado. I own a small cattle ranch and an antique shop specializing in vintage lighting. My daughter and I have run the ranch since 2015 as my husband's health declined. Then she left for college and most of the work fell to me. In mid-April of 2020, I developed back pain that felt more severe than the normal ranch aches. By late April, I couldn't void my bowels and then became unable to urinate. The pain and urgency made it impossible to ignore. I went to the local ER and soon after to a larger hospital an hour away. I was admitted to the neurological floor where I woke up paralyzed from the rib cage down. And that's when the full gravity of my situation hit, though I didn't understand it yet.
That had to be a little scary to go from being so independent to now all of a sudden experiencing some of those severe symptoms. How long did your symptoms continue, Virginia, and how did you reach a diagnosis of anti-aquaporin 4 antibody positive NMOSD?
As I said, after the larger ER visit where I woke up paralyzed, my neurologist recognized that he was dealing with something unusual. He ordered extensive tests. He did a spinal tap, and he consulted with a rural renowned hospital. They suggested I be tested for anti-aquaporin 4 antibodies. I underwent plasmapheresis and was started on steroids while I was waiting for the results of the blood test. The antibody test came back positive, confirming anti-aquaporin 4 antibody positive NMOSD.
Well, I am so glad you had a neurologist that was able to identify the need for the NMOSD testing, Virginia. Ilona, what did this look like for you?
I had repeated ER trips and spent many weeks and months in the hospital while trying multiple different therapies. My symptoms continued, but I was perpetually met with no answers. Eventually, I saw a neurologist who initially diagnosed me with multiple sclerosis, MS, after a spinal tap. I was treated for MS for about 4 years, even as symptoms of spasms and difficulty walking continued. In 2018, when I deteriorated, nonverbal, unable to read or write, with the loss of bowel control, a hospital neurologist retested me for anti-aquaporin for antibodies and determined it was an anti-AQP4 antibody positive NMOSD, not MS.
Being misdiagnosed with MS must have been very frustrating and kind of delayed that diagnosis to NMOSD. Unfortunately, that's something that we do hear a lot of in the NMOSD community. So thank you for sharing, Ilona. Denise, how did your diagnosis get confirmed?
Well, following that spring morning, when the tingling climbed my right side and I ended up in the ER unable to walk, I spent 23 days inpatient, blood tests, MRIs, x-rays, and a spinal tap. Finally, my neurologist diagnosed me with anti-AQP4 antibody positive NMOSD. I already had lesions on my brain and my spine based on my scans. She made it clear that if not managed properly, NMOSD relapse can come on suddenly and may result in permanent disability.
That had to be scary to hear as well. Can you share how you learned about Ultomiris and how your doctor came to the decision that it was the right treatment option for you to manage your NMOSD? Denise, if you want to just answer that for us.
Yeah, I left the hospital with steroids and a treatment plan that included plasmapheresis, but relapsed within 5 days. I tried Rituxan and then had another relapse. By years in, I had spent more than 70 days hospitalized. In desperation, I made an appointment at the world's famous clinic for a second opinion. They confirmed my NMOSD diagnosis and suggested I talk to my neurologist about a FDA-approved NMOSD treatment. My neurologist recommends Solaris. This was a good treatment plan option for me, but the every 2 weeks dosing schedule was not ideal for me. My neurologist and I spoke about Ultomiris when it became approved for adults with anti-AQP4 antibody positive NMOSD. I also discussed with my Alexion patient education manager. My experience has been positive overall. This has been my experience up to this point, and others may be different. I have not had a relapse since starting Ultomiris. I also use Alexion personalized patient support program, OneSource, for copay help and infusion scheduling. With my insurance, I'm also eligible for getting my Ultomiris treatments at home, which is a huge help for me.
Wow, that journey sounds pretty exhausting, and it sounds like the second opinion step was what really seemed a very pivotal point in your journey. So thank you, Denise. Virginia, you started on Ultomiris through a clinical trial. Walk us through what that was like.
Well, after confirming my diagnosis, they started me on rituximab and kept me on steroids. And after 3 weeks, they did discharge me from the hospital. I was sent to a rehab facility. What I didn't mention earlier is all of this occurred during the COVID-19 pandemic, and that added a whole layer of complexity to the situation. The COVID-19 restrictions made rehab a very isolating experience. I was in rehab for 3 weeks, but I had no rehab there. I returned home where the home health OT and PT started me on therapy. Feeling in the bottom half of my body very slowly returned, and this did give me some hope. After I was transferred out of rehab, a new neurologist told me about a phase 3 clinical trial investigating another treatment for adults with anti-aquaporin for antibody positive NMOSD. I spent 2 hours on the phone with the clinical trial neurologist discussing what the trial entailed, whether I was a good candidate. At first, I hesitated to participate, but as a former research scientist, I felt participating was important. How else am I going to we're going to find any potential treatment options if people don't take chances? Since I live in a rural area, each infusion meant driving to the biggest city, staying in a hotel overnight. And in the first 2 years, I worried every single time about the drive, the hotel, and of course, the infusion. Over time, those worries did fade, and I accepted that this was my new normal. And I felt it was good to be in control of my treatment and my recovery. Since starting treatment of Ultomiris 5 years ago, I have not experienced one relapse. This has been my experience up to this point, and others may have a different experience. After the trial, I did utilize one source, Alexion's patient support program, to help me find my infusion center, schedule my infusions, and help me navigate my insurance coverage treatment costs.
Thank you so much, Virginia. Your willingness to participate in the clinical trial clearly made an impact. Ilona, why don't you go next?
After NMOSD was confirmed as my diagnosis, MS medications were stopped and I started rituximab. I had to relearn how to speak and walk, early on communicating only in German until my English returned. With speech therapy, rehab, my mother as my caregiver, I progressed from a hospital bed at home to standing and walking with a cane. My neurologist prescribed me an FDA-approved therapy called Solaris, and I was on that for some time. Then, when Ultomiris was retested in 2024, I was interested in having more time between infusions with Ultomiris infusions once every 8 weeks, starting 2 weeks after the initial dose. Switching to Ultomiris gave me scheduling flexibility, like planning a 2-week trip to Germany without missing any infusions. As of today, I can say I have not had another relapse. This is just my experience, and others may have a different experience.
That's so good to hear. Now to our last question. How are you all doing now? And what guidance would you share with others on this journey? Ilona, why don't you start us off?
Well, I sold my 3-story townhome and moved to a 1-level home. I've used a wheelchair a bit, more so when I'm tired, but mostly I use a cane. For distance, I use a rollator so I can rest if needed. My daily goal, weather permitting, is 1 loop around my cul-de-sac, sometimes on good days 2, but not consecutively. Listen to your body, advocate for yourself, find a doctor who works best for you. Never lose hope. Independence matters to me. I've held on to hope for my life with help of rehab, my mother's support, and managing my NMOSD with an FDA-approved treatment. I'd also like to thank Patient Health Alliance for the patient advocacy support and allowing me my NMOSD journey.
That's amazing. You've come a long way, Ilona, and thank you so much for being here. Virginia, let's hear from you on your closing thoughts.
I'm now enjoying time on my cattle ranch and working in my antique shop. I have stayed diligent with neurophysical therapy, which has helped to improve my mobility, strength, and balance. As I said, I don't fear a relapse as much as I used to. I feel better prepared and supported. NMOSD is a life-changing disorder. You lose part of how your life used to be, and change with loss oftentimes brings grief. So if you're on your own NMOSD journey, never give up. Keep working towards a better tomorrow for yourself and your family. Make the most of every day. I very much enjoyed getting connected with and involved in the NMOSD community. I hope you will all take advantage of the support that is available to us all. And thank you so much for listening.
You're right. Virginia, NMOSD can be very isolating, so it's very important to be connected to community. So thank you so much for sharing, and thank you for being here. And at last but not least, Denise, why don't you close us out?
Okay. Well, with time and because I had no relapse since starting Ultomiris, I start drafting a new version of myself, traveling, walks with Harley and Hunter, dates with my husband, and seeing friends. Journaling and mindfulness helped me pace myself and honored my goals. Advocating for yourself, finding the support you need, and managing your NMOSD with the treatment that's right for you may help you move forward. This is my experience. Others may be different. NMOSD changed my life with the right tools for me and the right support. I found my way. Today, I share my story reflecting on how NMOSD did not just happen to me. It served as a catalyst for me to become a new version of myself. Thank you so much for having me.
Thank you, Denise. I think it's very important too to find your own coping mechanisms and how to weave your NMOSD into your life. So thank you so much for sharing. And that brings us to the end of our patient experience. I want to thank all of the stars, Virginia, Denise, and Ilona, for taking the time to chat with me here today and answer some important questions. I'd like to share one last thing here with everyone. Would you like to get connected with one of the STAR ambassadors for a phone call? Our Peer Connects program can match you with someone else with NMOSD for a phone call. Our STAR ambassadors have experience with Ultomiris and are willing to share their story and their journey and answer questions you may have. You can reach out by calling the number on the screen, and that's 1-877-576-7589, or visit our website, and you can fill out the form to get matched there. I will share a QR code to the URL on the next slide. Scan this QR code to get the URL on the Ultomiris website and to sign up for Peer Connects. That brings us to the end